Hi, and welcome to part 2, looking at the theoretical perspectives of personality disorders. So we're going to look at the psychodynamic perspective, the learning perspective, cognitive behavior perspective, biological, and sociocultural perspectives. The psychodynamic perspective and how they view personality disorders. So first, the psychodynamic perspective. The traditional Freudian theory focuses on unresolved edible conflicts in explaining normal and abnormal personality development. And again, there wasn't as much of the research based at that time with Freud, but more recent psychodynamic theorists have focused on the pre-edible period in explaining the development of such personality disorders as, narcissistic and borderline personality. Now, Hans Kohut, he was a founder of, or a researcher in what's known as self-psychology. Most of his work was regarding narcissistic personality. He saw that in early childhood, healthful narcissism, this is where the world revolves around the child, parents reflect back to children nourishing support of self-esteem, their positive feedback they would give each child. Eventually, later in their childhood, this childhood narcissism gives way to a realistic appraisal of self and others. Children that don't receive empathy and support from their parents develop a lower self-esteem from their perspective, and this can lead to feeling inadequate. The pathological narcissism involves constructing a grandiose facade, like a cloak of perfection, constantly working on it, risking of crumbling if they don't. So they have to keep nurturing this persona. Otto Kernberg, he coined the term splitting. Most of his work was with borderline personality. A child's failure to synthesize the contradictory images of good and bad results in a failure to develop a consistent self-image. Therefore, the splitting, eventually moving back and forth between seeing self as all good and seeing self as all bad. Margaret Mailer, she borrowed the biological term symbiotic, and she views the relationship between an infant and mother as symbionic, or an interdependence. Child's identity is fused with the mother. Slowly, children differentiate their own identity and their own sense of self from their mother's. Separation and individuation, it's known as. Now, failure to do that, failure to separate, is viewed as an underlying cause for borderline personality disorder. We'll touch base now on the learning theorist's view. And they view personality disorder in terms of maladaptive patterns of behavior rather than personality traits. Learning theorists seek to identify the early learning experiences and present reinforcers that may explain the development and maintenance of personality disorders. So you can imagine their treatment will be about how to relearn appropriate behaviors. There is in this category a family perspective, as many theorists that argue that the disturbed family relationship plays a role in the development of many personality disorders. Antisocial personality disorder is connected with parental rejection or neglect and parental modeling of antisocial behavior. The cognitive behavior perspective, including Albert Bandura, a social cognitive theorist, has focused on the role of observational learning in aggressive behavior, which is one of the common components of antisocial behavior, and that children acquire skills, including aggressive skills, by observing the behavior of others. Cognitive behavior oriented psychologists have shown that the ways in which people with personality disorders interpret their social experiences influences their behavior. Now, research on the biological perspective has shown familial links in various personality disorders that are consistent with, but don't prove, genetic means of transmission. Now, some of the research evidence shows that people with antisocial personality not only lack emotional responsiveness to physical threatening stimuli, but they also have reduced levels of autonomic reactivity. Autonomic just means these are the things that happen automatically in our body. We don't think about dilating our eyes, but they happen. That's an autonomic reactivity. So things like that. So people with antisocial personalities may also acquire higher levels of stimulation to maintain optimum levels of arousal. Jeffrey Gray introduced reinforcement sensitivity theory, and it focused on 3 neuropsychological systems. There's growing research for a molecular genetic and neuroimaging studies. In the biological perspective, technology is really starting to emerge with some ways for us to observe the unobservable. So when we look at the 3 neuropsychological systems, the first is known as the behavioral approach system, the BAS. And this is sensitive to and anticipates rewards. The second, the flight, fright, freeze system, the FFFS, a fear response to a punishing stimuli. And then the third was the behavioral inhibition system, the BIS. And it's a sensitivity to the potential conflicts caused by the expected rewards and punishments in a situation. Now, we can also reach out to and look at the sociocultural views. Sociocultural theorists focus on adverse social conditions that may contribute to the development of personality disorders, especially antisocial personality disorder. The effects of poverty, urban blight, drug abuse can all lead to family disorganization and disintegration, making it less likely that children will receive the nurturances and support to help them develop more socially adaptive behavior patterns. Now, these stressors are associated with increased likelihood of child abuse and neglect, which can in turn contribute to lower self-esteem, among other things, anger, resentment, lack of empathy, and callous disregard for the feelings of others. In other words, antisocial personality. That now brings us to the end of part 2. Our next video will be looking at treatment, and that will be part 3. All right, everyone, we'll see you in part 3. Bye now.